Deep within the rainforests of Africa, a tiny enemy lurks, the Ebola virus. Don't let its size fool you. This microscopic villain is responsible for a serious illness known as Ebola virus disease, or EVD. Scientists first discovered Ebola in 1976, near the Ebola River, in the Democratic Republic of Congo. Since then, outbreaks have occurred sporadically, primarily in Central and West Africa. Ebola is a zoonotic virus, meaning it can spread from animals to humans. Scientists believe fruit bats are the natural reservoir, carrying the virus without getting sick themselves. These bats can transmit the virus to other animals like chimpanzees, gorillas, and monkeys, which in turn can infect humans through contact with their blood or bodily fluids. Ebola is highly contagious, but it doesn't travel through the air like the flu. Instead, it spreads through direct contact with the bodily fluids of an infected person or animal. This includes blood, vomit, saliva, sweat, urine, feces, breast milk, and semen. Even touching surfaces or materials contaminated with these fluids can transmit the virus. Imagine Ebola as a tiny ninja, stealthily moving from one person to another through these fluids. It can enter the body through cuts, scratches, or even the mucous membranes in our eyes, nose, and mouth. That's why healthcare workers treating Ebola patients wear special protective gear, like masks, gloves, and gowns, to prevent contact with infected fluids. Once inside the body, Ebola wastes no time. It attacks the immune system, specifically the white blood cells responsible for fighting off infections. As the virus multiplies, it damages blood vessels and organs, leading to a range of symptoms that can appear anywhere from 2 to 21 days after exposure. At first, these symptoms might resemble those of other illnesses like the flu fever, headache, muscle pain, weakness, and sore throat. However, as the disease progresses, more severe symptoms emerge, including vomiting, diarrhea, abdominal pain, and unexplained bleeding or bruising. Without prompt treatment, Ebola can be fatal, with death often occurring due to multiple organ failure and severe dehydration. While Ebola is a serious disease, it's important to remember that we're not powerless against it. Knowledge and awareness are our greatest weapons in the fight against this deadly virus. Understanding how Ebola spreads, recognizing its symptoms, and practicing good hygiene are crucial steps in preventing its transmission. Washing our hands frequently with soap and water, avoiding contact with sick individuals, and seeking immediate medical attention if we suspect exposure are all essential measures to protect ourselves and our communities. While scientists continue to develop vaccines and treatments for Ebola, our best defense remains prevention. By staying informed and taking appropriate precautions, we can all play a part in stopping the spread of this formidable foe.